Talking to a healthcare specialist about your headaches is essential, and there are a few things you can do to make the most of your visit. Start by arriving early and being prepared. Make a list of all medications you've tried, including over-the-counter pain relievers, and whether they were effective. If you've had an imaging study, like an MRI or a CT scan, bring the doctor's reading, and if possible, the CD of the scan for your healthcare provider to review. And if you had lab work done, bring the results. Having records sent from office to office doesn't always work very well, so having files in hand for your appointment is always a good idea. In the days or weeks leading up to the exam, keep track of your headaches. For each day, write down the presence or absence of headache, and whether the pain was mild, moderate, or severe. If you were unable to work or engage in basic activities on a given day, note that as well. Also, make note of associated symptoms, particularly nausea or vomiting, and any sensitivity to light or noise. For women, migraines can be triggered by your period, so make a note of headache days in which you were menstruating. You can use a calendar to jot down this info, or keep an ongoing list in a notebook. You can also download a printable headache diary from the National Headache Foundation website at headaches.org. There are many simple ways to keep a headache diary, including several apps you can use, and it's an extremely useful tool to share with your healthcare provider. It can be very beneficial to bring your spouse, parent, or a close relative to your appointment. It's always better to have an extra set of ears in the room. But there's another reason. There's still some stigma around migraine from those who haven't experienced them, and even your closest loved ones might discount or underestimate the extent of your pain. Hearing from the healthcare specialists can be educational and may encourage them to be more supportive when attacks occur. Most primary care physicians are quite comfortable treating migraine and provide excellent care. But if symptoms persist or you're not appreciating a lessening in the severity or frequency of attacks, you might want to consider asking for a referral to a headache specialist, or if one is not available in your area, a neurologist. The National Headache Foundation maintains a comprehensive listing of headache specialists on its website, headaches.org. So if your healthcare provider doesn't have a recommendation, you can look for the one nearest you.